Welcome back to our extended 6 o'clock newscast as we answer your questions about COVID-19.
Joining us now are Secretary of Health Kim Malmstrom-Risden, Dr. David Erickson from Avera, and Dr. Allison Settle from Sanford. Thank you all for joining us here tonight. Our
first question is going to go to the Secretary. You and Governor Nome announced today that there is a community spread in Lyman, Hughes, and Beadle counties. Can you explain what the community spread is?
Absolutely. So when we're talking about a pandemic situation, community spread means we're seeing positive cases that we can't tie back to other positive people that the person might have interacted with or travel to a place that also has COVID. So when we talk about community spread, that means that person acquired the COVID infection from some place in their community, and we're not able to identify that.
All right, thank you. And can you also elaborate on the inmate in the women's prison that tested positive for COVID-19? How is the state responding to protect those folks there?
Absolutely. So we immediately followed our own recommendations, which whenever we're testing somebody for a disease like this, or when a person's sick, they need to be isolated. They need to be away from other people. And so that happened in this case while we were waiting for the test results for this inmate. The inmate is resting, is doing well, remains isolated, and we will do an investigation like we do with all other cases to see who this person may have had contact with, make sure that they're getting the care that they need as well.
All right, our next question comes from Bruce. It's something we've heard before. He asks, I've heard that everyone will eventually get the COVID-19 virus. Is that true? We'll start with Dr. Erickson.
Well, that's a good question. You know, would everybody acquire the virus? And I would say no. In a typical pandemic, you might see anywhere from 10 to 40% would be infected with the virus. So if we continue with stay at home, good social distancing, I think that'll minimize the spread and the infection rate. So at this point, I would say it'd be unlikely that everyone would be infected with the virus.
Dr. Settle, is there anything that you'd like to add to that?
No, I would agree. The only thing I would add is that although it might be that 10 to 40% that would get infected, that response to the infection or how that infection presents itself can be variable. So about 80% of people will have milder symptoms, not requiring hospitalization. They can stay home and heal at home. And then there's the smaller percentage that will become sick and need to be hospitalized.
All right, well, this next question is for our secretary. Jeffrey asks, I was tested last Monday at noon for coronavirus, and as of today, I still haven't heard back. Is this common? When should I have the results?
That's a great question. I know there's frustration out there. People want to have their test results as fast as possible, and I sure appreciate that. The way testing happens right now is tests either go out of state, they are now starting to come in-state at some of our health systems, or they go to the State Public Health Lab in Pierre. At the State Public Health Lab, we are testing high-priority populations. That includes folks that are working in the healthcare industry, folks that are hospitalized or in long-term care or other congregate types of settings. And so if you're not in that category, then your test is being sent out of state or is going to be handled by one of the other in-house labs that's bringing on capacity now. It's been an issue. We've had issues with supplies and just needing to bring up the testing capacity with the health systems, but I'm confident that there will be more testing availability very, very soon.
How long should they expect that to last, though, before they get the test results back?
So it really depends on which kind of lab the test is actually going to. In the case of the State Public Health Lab, we're able to turn those lab results in a day. Now, we do have some pending cases there that aren't those high priorities. Those will go out to those commercial labs, and that can take 5 to 7 days.
All right, and that brings us to our next question. We just reported earlier today about Avera and Sanford starting their own testing. This question comes from John. He asked, how many labs in South Dakota do the test for COVID-19? Dr. Settle, let's start with you. As we reported earlier, again, both Sanford and Avera are now testing for the virus themselves.
That's right. We started our testing yesterday, and we're able to test up to 400 samples in any given day, and we're anticipating a 24 to 48-hour turnaround time.
Dr. Erickson, how is Avera handling the testing?
Right. We stood up our lab yesterday, and I think we ran 20 samples yesterday, and we're hoping to run 100 samples today and tomorrow, and then go to 200 a day after that. We also use an outside lab, and then, of course, we use a state lab, too. So we have three various options, and we, like everyone, want to get the results sooner so we can get them back to the patients so they can get that information.
Now, our next question is for the Secretary of Health. Chad asked, the number of infected people, how many have successfully recovered without a stay at the hospital, and can those people become infected again? Secretary?
Well, very happy to report that we've seen 6 people fully recover from COVID-19 in South Dakota. And so to Dr. Suttle's point earlier, 80% of folks have mild or very mild symptoms, and they're able to be at home. They need to stay away from other people, take precautions, but they can get better. And so we're really pleased to see that progress. We maintain contact with all of the positive cases, and so we're hoping to report more recoveries very soon. Now, to the question about can a person become reinfected, that's an unknown at this point. And so we're encouraging people, if you've had COVID, you may have some immunity, but still take those precautions and do the right things so that you're protecting yourself and other people.
Dr. Suttle, would you like to add something there?
I agree. I think it is unknown, but if we look at other viruses that are similar, we haven't seen that infection or reinfection rate, but that is something we're keeping a close eye on.
Okay.
Dr. Erickson, anything you want to add as well?
No, I would agree. There is a lot unknown there, and as a typical virus, you would hope you'd develop immunity and be unlikely that you'd get that infection again. But I think until we know more and understand really further details on this virus, some of that's just plain unknown.
Okay, thank you. We have to take a quick break.
We'll be right back with more of your COVID-19 questions for our guest coming up right after this.